Hi everyone, once again welcome to my OET channel. Today we will see some important topics regarding home visit. So many students have doubts how to find out whether the question is for home care request or home visit request, because in some case note or in some writing task they will not mention that you have to request home visit, or even in the recommendation paragraph they will not mention the same. So how we can find out? So this is the thing you have to give concentration while reading the case note. When you will read the case note, just as a flow, when you will read at the end of the story, you will have some recommendations, right? It is not under the plan or somewhere, but if you when you read, of course there will be some type of recommendations which will give you the hint that you need to request home visit. Like example, I can tell you. Example, one patient got admitted in the hospital, and at the end of the day, that is today, he is planning for discharge. He is getting discharged, but patient's cousin requested home physiotherapy. That's why you are writing letter to his GP. So this is a non-case actually, and you are writing this letter to request home physiotherapy. So what is that? Actually, you are requesting home visit only, but it is true. It is through the actually through general practitioner to physiotherapist. So that is the thing. Another one more thing you can see, as in general you are writing letter to head of community health nurses, or you are writing letter to manager of nursing home, but in the request or in the writing task they didn't mention anything specifically, but they wrote it is continued care. So continued care means, what is that? Continuously how to care. It's not a particular time period. They didn't give that a particular time period. So that means until his or her complete recovery, you have to give a home visit. So continued care, ongoing care, something if it is mentioned in the writing task means it will be home visit. That means to a particular, not to a particular time period, until patient's complete recovery or stabilization you have to give care, but it's not nursing home. That is a thing, that is a twisting question. Okay, if you read the address, if it is the manager of nursing home, don't think that it will be to the always it will not be the admission into a nursing home. Sometimes it will be a community health nurse request only. That means we are requesting someone from the nursing home to give home visit, or to go to the patient's home to give some care. So that things and all you can get it from recommendation. So in the recommendation paragraph, maybe they will give continuous dressing, and it's like a weekly dressing, or like a daily position, daily skin integrity assessment, or wound care, or something like that. So from writing task as well as from recommendation, you can get the hint for visit, whether it is a home visit request or it is a admission. So admission means, of course, they will write the patient is ready for discharge to the facility or nursing home admission, something like that. The important thing is make sure patient is getting discharged to home. Okay, if the patient is going home and we are requesting someone to assist or someone to give ongoing care, continued care, or else like maybe like respite care. Even respite care also can be for a shorter period, but they will give the time period 1 month, 2 weeks, 3 weeks, like that. Even if it is like that also, it is a home request only. And other one more thing, it is their home care. So they used to give that home care. Home care service means it is not it's not for not only for nurses. Sometimes it's for social worker, or it is for housemaid, something like that. That means they have to give help to help for the home works and the patient. That means both the home duties, I mean home activities like cleaning, washing, arrangements, these things, shopping, these everything, as well as patient care also. So like that also they will mention in some case note. So that means also it is home visit only. That means they have to go in a frequent time period and they have to give the care. And sometimes they used to give that directly also. They used to give directly. That means they need home health, home care. Or sometimes they used to tell that request community health nurse or practice nurse or tissue viability nurse to assist patient at home. So like that they will give directly. to home means it is easy question. It will not be like a tricky question. No need to think about anything else. You can just write home visit request. Sometimes you will get more confusion whether it is home visit request or whatever the thing. If you are more confused whether it is a home visit or no, don't waste the time to think about that. So just you can write it in the normal way, like he requires ongoing care or continued care from your service. That's enough. Okay, from your service means it can be home visit or it can be the admission, but don't write from your facility. From your facility, if you are not confirmed with the home visit means don't write from your facility. From your facility means you are getting you are requesting actually home visit only, someone have to come from there to here. At your facility also don't write if you are not sure. At your facility means you are transferring the patient to their facility, to the hospital or to their rehabilitation center or somewhere. So at your facility means it's not home visit. Always write from your facility or from your service. So that is actually same for, it is apt for home visit request. So I hope it is clear for you. Just I will display some hint during these videos so that it will be easy for you to find out whether it is whether it is a home visit request or it is like a normal request to admit the patient there. Okay, I hope it is clear for you. Thank you for watching. We will see with another one informative video. Until then, bye. Take care.